Hi, I'm Dr. Jim McDonald. I'm a pediatrician. I'm also board certified in preventive medicine, and I'm also the commissioner of the New York State Department of Health.
And I'm Dr. Michelle Morse, a practicing internal medicine doctor and the acting commissioner for the New York City Health Department.
We know there's been some confusion, and so we'd like to talk about some hot topics, including immunizations and viral infections.
So we decided we would team up and answer questions from New Yorkers about flu, COVID-19, RSV, and measles. So Dr. McDonald, a question we get from New Yorkers, is it true that only old people and babies can get RSV?
Anyone can get RSV. Babies and the elderly have a harder time with RSV, more likely to end up in a hospital or pass away, but anyone can get RSV. Dr. Morse, we got this question in. What are the current recommendations for the new RSV vaccine? Who qualifies and when should they get it?
Excellent question. We're very lucky to have this RSV vaccine. Anyone who's 75 years and older should immediately get the vaccine if they haven't had it. Anyone in the 50 to 74 age range with a chronic condition should also get it. And then people who are pregnant, 32 to 36 weeks gestation. And finally, our babies who are quite susceptible to RSV. Babies up to 8 months old can also get the RSV vaccine. Our older adults who already had the RSV vaccine in the past still advised to get the vaccine.
So if you've gotten the RSV vaccine once, you're done. It's a one and done vaccine, so you don't need to get it if you've already had it once. I had mine, I'm done for life.
Is it safe for pregnant people to get the RSV and flu vaccines?
Yes, it is. You can even get them at the same time. The Food and Drug Administration has approved both the RSV vaccine and the flu vaccine while you're pregnant. It can protect not just you, but also your baby. Now, of course, if you have a question, talk to your OBGYN. So, Dr. Morse, we received this question. Why are we seeing so many cases of measles again?
It is really unfortunate that we're seeing so many cases of measles across the country. Measles is one of the most infectious diseases and viruses that we see. And we're lucky in that we have a vaccine that is very, very effective at preventing measles. Unfortunately, fewer and fewer people have been getting the measles vaccine. So Dr. McDonald, New Yorkers are asking if the vaccine is so effective, why are people still getting measles?
Yeah, so measles is a very contagious disease. In fact, the most contagious disease. And quite frankly, not everybody has the vaccine. And the people who we see getting measles are the people who don't have the vaccine. All right, so Dr. Morse, here's another question we got. What is being done to improve measles, mumps, and rubella immunization rates?
It's such a great question. It is a real priority for us in New York City to make sure that communities all across the city understand where they can get the vaccine, why it's important, and how it protects not only the person who gets the vaccine, but their family and their whole community. So really sharing that message in as many places, in as many languages, in as many geographies and neighborhoods as we possibly can is a big priority for us. And then we're also engaging providers. We know that pediatricians are one of the most trusted people to share the message about why vaccination is so important. And how about in New York State, what are you all up to?
So keep in mind, vaccines are free, right? So they're covered by every third-party payer or insurance company. We do a lot of public education on the vaccine as well, that it is really the best protection for individuals. We do engage the pediatrician community in particular, and we're doing a lot of work really just making sure different communities have their questions answered. One of the things I do is go around the state from time to time and just talk to people in smaller rooms and just answer questions. We're trying to build relationship, establish trust, make sure people make the best decision for themselves. And also, we enforce the vaccine requirements in New York State.
So Dr. McDonald, New Yorkers are asking, what is the difference between mRNA vaccines and Novavax, and which one should they get?
Yeah, so interesting. Both vaccines are approved by the Food and Drug Administration. Now, messenger RNA vaccines, and by the way, all of us have messenger RNA in our body. They make protein. You cannot live without messenger RNA. What the messenger RNA vaccine does, though, is teach your body to make the spike protein so your immune system makes antibodies. What the Novavax does, it just got a protein subunit. Your body responds to the protein subunit, and that's how your immune system makes antibodies. Both vaccines teach your body how to make antibodies. Now, when it comes to deciding which vaccine you get, that's really up to you, and you can talk to your doctor about it. That's what I would do. So Dr. Morse, one of our New Yorkers wrote this question in. Why is it still called COVID-19 and not COVID-25 since this is a new strain?
It is an interesting question. COVID-19 is the name because this is a novel coronavirus that was discovered in 2019. And it is true that there are some changes to the coronavirus as it continues to evolve, but COVID-19 is the strain. So New Yorkers are also asking us, are at-home COVID-19 tests still reliable for detecting current strains?
Yes, so the at-home tests are still reliable, but keep in mind, if you test very early in your symptoms, sometimes you need to test again in a day or two just to make sure you are indeed negative. Dr. Morse, here's a question we got from one of our fellow New Yorkers. Are we more concerned about COVID-19 or flu in terms of new strains?
Well, we are right at the beginning of respiratory viral season, so we're worried about both right now. The challenge with viruses, of course, is that they do evolve and change. This is why it's so important to get the updated COVID-19 and flu vaccines every year. If you haven't done it yet, go do it right now. And I would say that at this point, we worry about both. When we're heading into respiratory viral season, it's pretty hard to predict if one of the 2 or 3 main viruses, RSV, COVID-19, and flu, are going to be most dominant and at which period of time. So that's why our recommendation is the best way to protect yourself, your family, and your whole community is to get the updated vaccines this season. So New Yorkers are also asking which of the viruses, COVID-19 and flu, is most serious.
So when you look at our data for New York State for 2024, COVID-19, we saw 2,775 people pass away related to COVID. We saw a little over 650 people pass away related to the flu. So COVID was more serious. So we saw more deaths related to COVID, and we also saw a lot more people admitted to the hospital related to COVID as well. So COVID is more serious.
How effective is the flu vaccine for this year's strain?
Yes, we won't know how effective the vaccine is until the end of the year, because remember, the flu vaccine is made as a prediction of what are the strains we're going to see based on what we saw in the southern hemisphere of the United States. We saw reasonable effectiveness in Australia, 50% of preventing illness, 50% of preventing hospitalization. So pretty good effectiveness for a flu vaccine. We'll have to wait and see. What we know from year in and year out, though, the people who get the vaccine, much less likely to pass away, much less likely to end up in a hospital. Dr. Morse, one of our neighbors asked this question: why do these viruses hit hardest in the fall and winter?
I'm glad they're asking. We're heading right into that season. When it's colder outside, folks tend to stay indoors more. The more you're indoors with others, the easier it is for viruses to spread amongst people. We're also heading into the holidays, and the holidays are a time when people are traveling and hanging out with each other even more. That's a great place for viruses to spread, unfortunately. And then another thing is that it can be drier in the wintertime, and that dryness allows viruses to spread more quickly through the air and get into your eyes, nose, mouth, etc. much more quickly and easily. So we're also hearing from New Yorkers whether or not we expect this to be a severe flu season.
I'm an old public health physician. One of the things I've learned a long time ago is, as a public health physician, if I've seen one flu season, I've seen one flu season. They're all different. It's kind of difficult to predict what we're going to see this year. My main message is the best protection is make sure you're up to date in your flu vaccine.
Thank you from New York City.
Thank you from New York State.
Stay healthy, New Yorkers.
We're all neighbors.